Now, the internal respiratory obstructive, what are the various events? Choking and gagging are the most common. Choking means when some object enters into the respiratory passages and it excites violent coughing to cough it out, and when it is not successful, then the intense laryngeal spasm of the vocal cord occur, and that causes asphyxia. So this is the process. So choking is a form of asphyxia in which there is mechanical occlusion of the air passages by any solid object. And the important in this is that the size of the object is doesn't matter. It usually it is small, but the touch to the laryngeal walls, touching of the object to the trachea or any inside layer produces intense vocal cord spasm. So the size is not important, and when it enters, it touches the internal mucosal lining and the vocal cord, and it produces an intense spasm of the vocal cord. So this is how the vocal cord gets into spasm. And by touching a reflex spasm, this is so intense that it doesn't relieve and person get asphyxiated. Similarly, in epileptics, during the attack, when they fall down and they are lying supine, their tongue fall back and it occludes the respiratory passages by falling back and occluding the respiratory passages by touching with the posterior pharyngeal wall. You can see the tongue falling back and the posterior pharyngeal wall at this level it touches and it blocks. So in epileptics, they get choked just by falling tongue back and occluding the respiratory passages. But sometimes there is vomitus, and that vomitus gets inhaled and it blocks the air passages.